Radhe Radhe to all, and I hope everybody is doing perfectly fine. So, today, as we all know, is 13th Feb and it's World Anemia Awareness Day. So, I thought just to brief you all about the basics of what is anemia and what the current WHO theme is for anemia so that we can prevent this entity. So see, anemia is one of the world's biggest health issues, but awareness of the problem is very low. And per se, it's not a disease, but it's a condition. So where, because of many other systemic illnesses, the patient can land up in low hemoglobin levels. So how you define it? It's basically a condition, as I told you, characterized by, so there are no range of hemoglobin, ranges according to age and sex of the individual, and there is a lower threshold also. So if below that, so it is characterized by lower than the normal number of RBCs or hemoglobin concentration, which leads to decrease. So in turn what happens? Agar hemoglobin kam hoga, what will happen to our body? There will be a decreased capacity of the blood to carry oxygen. So proper oxygenation of the cells will not be there. See, WHO, when you know what is anemia, जब आपको पता है कि we measure anemia by the hemoglobin levels, so we should know the cutoff. So basically, there are different values, and once you label it as anemia, and then you categorize anemia also as mild, moderate, and severe. So, but what is the normal range? That is no anemia. Children may you see, usually it ranges from 10.5 gram per deciliter. These values are given in gram per liter. So when you see it gram per deciliter, easy to remember. So it ranges from 10.5 to 12 gram per deciliter. So there are range. So by at birth, like 6 months to 23 months of children will have hemoglobin of more than 10.5 gram per deciliter. 24 to 59 months, you can say more than 11 gram per deciliter. 5 to 11 may 11.5 gram per deciliter. 12 to 14 year non-pregnant female will have more than 12. 12 to 14-year boys will also have more than 12. So in children as a whole, you can say till 14 years, it ranges from 10.5 to 12. Now coming to adult female and male. So adult male 15 to 65 years of age group or non-pregnant women. So adult, non-pregnant women you say. So females may usually it is more than 12. So range when it is asked it is usually 12 to 15 gram per deciliter. And when you see in 15 to 65 male, it is more than 13. That is 13 to 17.5. You can say gram per deciliter. So without unit, the values are meaningless. So you have to mention gram per deciliter. So pregnancy, it's a condition of low hemoglobin like hemodilution state. So first trimester, female can have more than 11. Second trimester, it will decrease to 10.5 gram per deciliter. And third, it will be less, a bit more, then regain again. So you can say below, it should be approximately more than 11 in pregnant, and non-pregnant can be more than 12. Should be more than 12 to call it as normal, no anemia. Then range of mild, moderate and severe anemia ranges according to age group. So why there's a hue and cry on 13th Feb as World Anemia Awareness Day? So see, WHO, it gives you a theme. So 2026 World Anemia Awareness Day, it focuses on your raising the global awareness of blood health. See, everybody of us know this term. It's very common. Anemia, every other person you ask, they know what it is. Khoon ki kami, they will say something. So it's basically hemoglobin, decrease in hemoglobin levels. So, in this WHO, the theme is to raise the awareness among the people for blood health, emphasize early screening, prevention, and management of anemia across all ages. Even in like we have marathon also, we have you see the names are being given for the marathon. So that is that is a run for a cause, right? So एक initiative है branded as Global Anemia Thon 2026. So that encourages the individuals, healthcare professionals and organization to raise their hands for blood health. This is the theme for WHO as for anemia. So it promotes what? It promotes awareness of iron deficiency, hemoglobin levels, and patient blood management. And for athletes also, it highlights the role of baseline blood health monitoring. Broader population also it encompasses to adequate oxygen delivery and overall wellness of the patient. So many strategies are being employed by the government and many other organizations. So see, today, 13th Feb, so six continents today they are uniting for World Anemia Awareness Day, and it's a 24-hour global journey of stories, conversation, and collaboration. It's actually a serious global public health problem, particularly which age group is affected is the young children and the pregnant women. We'll discuss the stats also worldwide and in India. So see, WHO estimates that just see the data. In less than 5 years of age group, 42% of children are anemic. And worldwide, among pregnant women, 40% of pregnant females are anemic. So 42% is a huge number. 42% of children in less than 5 years of age category, more than 40% of pregnant female worldwide, they are anemic. So it's a alarming condition. इंडिया का डेटा अगर हम देखते हैं it affects over 40% of population, particularly affecting women and young children. So with government initiative, many initiatives are being, as I told you, government who NGOs are there, many other organizations are there. So they like Anemia Mukt Bharat, they aim at reducing its prevalence. So अनीमिया इज वाइडस्प्रेड कंडीशन इन इंडिया है और जो नेशनल फैमिली हेल्थ सर्वे हुआ है 1921 डेटा एंड सेइंग यू that also poses a alarming statistics. Just see the percentage. 67.1% of children aged 6 to 59 months are anemic. 59% of adolescent girls, 15 to 19% are anemic. 31% of adolescent boys are affected. 57.2 of women of reproductive age group and 52.2% of pregnant women are also anemic. So it's crossing more than 50%. And see, anemia, as we know, it is caused by a number of causes are there, जो हमारे control में नहीं है. So like many causes are there, hemolytic anemia. It could be because of some other systemic disease. But what we can prevent is the two common nutritional deficiency anemia. That is, most common one is your iron deficiency anemia, followed by your vitamin B12 folic acid deficiency. So why this 13? Even I was also like inquisitive why this 13 Feb date is chosen for anemia. 13 is chosen as Anemia Awareness Day because just see it represents 13 जो होता है ना, it represents the ideal hemoglobin number for optimal blood health. So now it's relatable. I told you in male it should be 13 to 17.5, female it should be 12 to 15, in between 12 to 15. So this number represents. So as we say, unlucky for many, but lucky for some. So that is why this number is chosen. So see, when you know what are the alarming signs, you should go for this test. There are reasons, maybe because if you are having heavy menstruation, heavy bleeding, or there is working in hookworm infestations होते हैं patient को, then patients are lacking in vitamins which are required for your hemoglobin synthesis. Many disorders of digestive system जहाँ malabsorption हो रही हो, like pernicious anemia and all, then RBCs are destroyed. So all these conditions, reasons, being a normal person, non-medical person, you may not know what is the reason for your anemia, but symptoms आप ध्यान में रख सकते हो. You are feeling lethargic. जैसे पहले आपको कोई काम करने का मन करता था. You don't feel like getting up from the bed. You are not able to walk, climb the stairs. So all those conditions like fatigue, dizziness, चक्कर आते हैं, you feel fatigue, थक जाते हो आप जल्दी, hair loss, freezing, you don't feel like doing anything, like just sit. Then you have breathlessness on climbing stairs. So many other symptoms जो होते हैं which is not normal. So then you can think of maybe my hemoglobin levels are going down. So treatment, ideally you should consult a physician. He may prescribe you necessary vitamins. May put you on drugs. Diet modification is a very important one, जो कि आप पहले से ले सकते हो before going to a physician. That is what is important catch. Prevention of anemia. So nutritional anemia you can very well prevent by following a strict diet pattern, exercise, good daily habits, So that will improve your anemia, that is, improve your hemoglobin levels. Then blood transfusion, so these are prescribed, advised by your concerned physician, whether you need, what level of anemia is. अगर बहुत सीवियर anemia होता है तो पेशेंट को ब्लड ट्रांसफ्यूजन भी देना पड़ता है, एंड अगर माइल्ड हो रहा है तो दे कैन बी गिवन सम काइंड ऑफ सप्लीमेंट्स, विटामिन आयरन सप्लीमेंट्स along with your strict diet improvement. So this is just a chart. You Google around and you will get a number of food which will increase your hemoglobin levels. But the commonly food, see, always go for the seasoned vegetables and fruits, like your spinach, apple, dates, bananas, beetroot, pomegranate. So these are the common food items which you include in your meal to increase your hemoglobin levels. The lean meats, eggs, beans, there's a number, huge list is there. Peas, nuts, berries, cereals, milk, dark chocolate, beef liver, white beans, so all the milk, so all these are oysters. So there are list. And nowadays, upcoming things are your chia seeds, all the seeds, pumpkin seeds, sunflower seeds, so all these things you can just mix in your salad and then take it. So whole grains, so all those things are there. Sweet potato is a very super, rich superfood. Then you can go for grapes, pineapples, strawberry, all the kind of berries. So all these things, if you include in your black gram, all those things, if you include in your diet, so you'll keep on having a good healthy habit, and you will improve your anemia and maintain the hemoglobin levels. So just focus on these important superfoods. So what's the key message? So it's basically early detection. ऐसा नहीं है कि you just keep on ignoring your symptom कि नहीं ऐसे I got tired because of something maybe else. No, early detection and screening for anemia is very small test you require for it. It's just a prick. You get the blood sample, test it in the lab, and you get your hemoglobin details, CBC level, CBC report in fact. But all those things will be checked by your clinician. So best is to get at least a baseline level of hemoglobin to improve your diet around. So early detection and screening for anemia in children, pregnant women, and there should be a global collaboration which to share the knowledge, resource, practical tools to better this. So get your hemoglobin levels checked, or you can just go for a CBC test which will give you hemoglobin levels and other parameters. So based on your CBC report, then the clinician will judge ki which type of iron, which type of anemia you have, what is the cause. So they will go through these detailed report and then advise you for the test which you need to go. Then take iron-rich food, supplements after consultation only. Don't take any kind of supplements without knowledge of your physician. So World Anemia Awareness Day, as we are celebrating it today, it aims to raise the awareness of anemia, especially iron deficiency, I told you, and also vitamin B12. So just focus on the food items which are rich in iron and vitamin B12. And also additionally, one important thing I would like to add, go for vitamin C rich foods. Amla is the richest source of it. Any food item which is rich in vitamin C that aids the absorption of आयरन. सो वो आयरन आप जो सप्लीमेंट लेते हो, अगर आप उसको विटामिन सी के साथ लोगे, सो आपकी आयरन एब्जॉर्प्शन और बढ़ेगी. सो दैट विल increase the iron level much more faster. And also this day aims at to become a global driver to promote the importance of preventive action to support blood health. So thank you so much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Have a great day.